Good afternoon, I'm Alan Unell, and this series of videos is Healthcare Reform Advocacy, where we address problems in the healthcare system and then take actions to try and make them better. Let me point out that the text for today's lecture is actually in the description box below. It is the Healthcare Advocacy Newsletter for today. And all of the links and references and contacts and actions will be in that newsletter. Okay, today we're going to talk about state-based universal health care. Now, in our videos and in our newsletter, we have advocated long and loud over and over again for universal health care. Our 35 peer industrialized nations all have it. They save a fortune. They deliver quality care to everyone. They bankrupt no one. I know some of you are going to say, what about the wait times? It turns out they're just the same as they are here. They have developed unique ways to implement and pay for their systems, and they're all different based on their own culture. Well, so we've been pushing for that. Representative Jayapal's HR 3421, the much improved Medicare for All, is the best one that I've seen. It is a single payer system in which the government operates the insurance company. A way to think of it is public insurance paying private providers. That model works really well with things like traditional Medicare, not Medicare Advantage, which is private insurance. Okay, now right now, in our situation, I'll give today's date is October 18th, 2023. Congress is at loggerheads with itself right now. There is an important struggle to keep democracy in place in the United States, as opposed to an authoritarian dictatorship, which I got to tell you, if we don't win this out, that's on the horizon for us, and it's not good. And we can argue about that all day, and that's the problem. We argue about that all day, and there's no time left to talk about how to fix healthcare. So let's talk about one-payer state-based insurance. And the reason is, since Congress is so busy struggling with maintaining the democracy, individual states are actually considering implementing universal health care for their residents on their own. So some of the states that are interested in doing this, it's quite a long list, so hold on, I'll read it to you. It's California, Colorado, Illinois, Maine, Maryland, Minnesota, Missouri, New Jersey, New York, Ohio, Oregon, which is really doing much better than anybody else, Pennsylvania, Rhode Island, South Carolina, Vermont, and Washington, which is also in second place behind Oregon, in my opinion. There's going to be a link in the story to a Healthcare Now page, which lists each of those states, and if you click on the state, you'll see how much progress they've made with their legislation. Okay, how would state-based universal health care work? State-based one-payer plans require the state to collect federal, state, and private health care spending into a single pool. A designated state agency then pays providers for the patient's claims, hence the term one payer. Providers receive payment from a single payer, the state. Now, it's a good idea since it'll demonstrate how to implement the system, and it stands a pretty good chance of passing somewhere before the federal program could pass. So, there's coordination with federal agencies that has to be accomplished to make it happen, and that's really the subject of this video. If a state wants to implement such a system, they've got to enroll Medicare and Medicaid subscribers and federal employees and TRICARE subscribers, that's military, families, and retirees. The states will need waivers from the federal government to do that. The states must also be able to have private employers offer the state-based insurance to their employees. And to do that, there needs to be a waiver from the Employee Retirement Income Security Act, or ERISA. There also needs to be some kind of coordination with the IRS, because when employers make payments for health insurance premiums, it's pre-tax dollars, and when you and I purchase a health care plan on the open market, we do it with after-tax dollars. So there's some kind of adjudication that has to happen there. Well, so there's quite a few waivers. A lot of coordination with federal agencies. Good news. Representative Khanna of California has grouped them all together in a single bill, and he's going to be introducing that bill to Congress shortly. And all of us can help the effort by encouraging our representatives and our senators to co-sponsor and support it. The bill would provide all required waivers and exemptions, and they're all contained in one act of Congress directed to each appropriate federal office for prompt action. The required waivers, good news on this, do not sunset. They don't have a fixed termination date. They are valid as long as the state demonstrates continued compliance with these essential requirements. Number one, they have to cover at least 95% of the state's population with their health insurance. Number two, all patients previously covered by a federal program like Medicaid or Medicare or CHIP or whatever have to continue to get health care benefits that are at least as comprehensive as what they have now, and hopefully more. Federal debt does not increase. That's the last one. So it's essentially done at no extra cost to the federal government. This bill has a name. It's called the State-Based Universal Healthcare, SBUHC. And one payer states actually gave us a heads up on this, and thank you to them. So here's the action we can all take. Representative Khanna's state-based universal healthcare will modify federal restrictions on Medicare, Medicaid, ERISA, and taxation, and allow states to create the universal healthcare system. We can call our representative and senators and urge them to co-sponsor and support it. So I'll read you the phone number, but it's going to be in the newsletter below. 202-224-3121. 202-224-3121 to get in touch with your congressional representative and both of your senators. Tell them to co-sponsor and support the SB State-Based Universal Health Care Act. There's also going to be a link with some talking points. They're tailored to Oregon, but you can make use of it. The other thing you can do, which is kind of important, is there's going to be a link in the newsletter, one for the representative, one for your senators. If you click on it, it sends them an email. And you can do that too, and you can share those links. So I would appreciate it if you would do that. That's what we have for today. Remember, like, share, subscribe to the Healthcare Advocacy Newsletter. Have a good afternoon.